is 74-year-old man, high diabetic, hypertensive,
Okay.
quite obese. He's
Achha.
110 kgs. He had pain in back
Okay.
with a severe sciatica,
Mm-hmm.
and so he avoided walking. We did an MRI,
Mm-hmm.
we did an X-ray for him. He was having, as I called, spondylolisthesis. His spine was shifted
Mm-hmm.
because of degeneration and obesity,
Mm-hmm.
and his nerve was compressed.
Achha.
So he was dragging his left foot.
So, sir, as we spoke, I mean, as you just mentioned, now you are seeing a lot of patients who are young. Sedentary lifestyle is one of the reasons. What are the other etiology or the reasons?
Because of the addictions to mobile, because of sitting down continuous on the tab or sitting continuous on the laptops.
They don't go out anymore to play.
No physical activity outdoor.
Sitting straight for long hours is good for your spine.
No,
Myth or
not
fact?
at all. Most people, they sit on the ground,
Acha.
and for hours they are involved in either reading papers
Acha, sitting on the ground.
or studying.
Okay.
That is the worst thing.
Does sleeping on the floor helps?
Sleeping on the floor is really good, but getting up and down from that ground is not at all good. And you can turn to a side. Okay, turn to a side, keep your legs down, put a weight on the shoulder and get up.
And
This is the
get up.
best thing,
Okay.
because the weight comes on the shoulders
Okay.
and not at all on the cervical or lumbar spine. And you change your position, even for the spine operated patients,
Acha.
which we operate. Yeah, be it for just for disc or for fixation. We always advise, yes, you sit, but not for
But not
more than 40-45 minutes. Patients just keep on lingering around. They don't take medical aid, be it in the form of physiotherapy or medications.
Back pain. It's just not an ache, it's a silent epidemic stealing your sleep, mood, and mobility. One wrong posture, one ignored symptom, and you're suddenly battling chronic pain that just won't go. The truth is, almost all of us have faced back pain at certain point of our lives, whether a mild one or a crippling one. Is it just a muscle pull, or the start of something very serious like a spinal disorder? Today, we are pulling back the curtain on back pain, talking about the red flags, the myths, and the treatment aspect. So, if you have ever winced while getting out of the bed, this episode is your wake up call. Joining us today, we have Dr. Siraj Basade, one of the finest minds in the field of neurosurgery, with over 2 decades of medical experience and more than a decade experience, which is dedicated to neurosurgical practice. With over 1,800 brain surgeries and 1,000 plus spine surgeries to his credit, he brings not just technical brilliance, but a deeply patient centric approach to every case that he deals. His work in oncosurgery, neurosurgery, spinal tumors, and vascular neurosurgery has earned him recognition at various national platforms. Hello and welcome to another episode of Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Siraj Basade.
Hi,
Hello,
Tushita.
sir. Welcome on today's podcast.
Hello, Tushita. How are you?
I'm good, sir. How are you? How does it feel to come on this podcast? I've been chasing you for quite some time.
Right. sorry. Actually, things are going around helter-skelter.
Yeah, I
And
do understand.
luckily, we have found out time today.
Yes.
Definitely.
I can't complain. You're a neurosurgeon.
Nothing of that sort, but just things are going on.
I
And,
understand, but we are so happy to have you on today's podcast.
Yeah.
And the most interesting part about this podcast is when I reached out to you saying that, so what topic should we discuss? So you being a neurosurgeon, you didn't choose on any topic which is very complex or a surgery related topic,
Mhm.
but it was lumbar spondylosis, which is another form, a version of back pain. So, what's the reason behind it? Why lumbar spondylosis is our topic for the day?
See, in today's world,
Uh-huh.
talking about complex tumors and all these things is a medico's problem and a medico's guilt, you can say.
True.
Common public, what they see, ki I should be comfortable in my lifestyle
Uh-huh.
and I should be working with full enthusiasm.
Uh-huh.
Back pain is one thing.
Okay.
If it comes, it's the most irritating problem.
And I think there's no,
And-
not even a single soul left on this planet who has
Right.
not faced back pain at certain point of life.
Exactly. So be it, even today, we are seeing pediatric patients
Achha.
and right up to geriatric.
So when you say pediatric, what age range are we talking about?
Today, to be very frank, and it's a very wrong thing for a society.
Mhm.
I am seeing children of 3rd or 4th grade, they are
Coming with the
having
back
pain. Yes, because of the addictions to mobile, because of
Acha.
sitting down continuous on the tab or sitting continuous on the laptops.
They don't go out anymore to play.
No physical activity outdoor, or you
Mhm.
can say least,
Mhm.
but maximum time on screen and on the in the same position. So this is what creating headache, back pain, even giddiness in children.
Mhm.
And at this age, seeing them having complaining of the back pain, my back is paining,
Mhm.
it's very wrong thing and very pitiable thing for us.
Mhm.
That children of this age, rather
Mhm.
than playing out, they
Mhm.
are on the screen and all these things.
Okay. Okay.
So that's why I've chosen this topic of spondylosis, because
Uh-huh.
yeah, be it for occupational thing
Uh-huh.
or be it for a sportsman thing.
I think it caters to a larger audience.
Yes.
That's true.
And today even our OPDs,
Uh-huh.
neurosurgery OPDs, there are like, it consists of around, you can say 30% or 35% brain,
Mhm.
but 60 to 70% of back pain and spine problems, be it cervical
my
or be it
God.
lumbar.
Mm.
So that is the thing we have chosen the common topic, but
Mhm.
a very difficult to deal with problem
I know.
of back pain today.
True. Diving deep into lumbar spondylosis,
Right.
back pain और lumbar spondylosis में क्या differences है?
Back pain, you can say, is only tip of iceberg of the phenomena called as lumbar spondylosis.
अच्छा.
Lumbar spondylosis, spondylosis is a very primitive term,
अच्छा.
and it includes inflammation of the joints.
Mhm.
It is arthritis.
Okay.
So it just called as the arthritis of the spine, be it
अच्छा.
cervical or be it lumbar.
अच्छा.
Coming to our topic today, lumbar spondylosis.
Mhm.
So lumbar spondylosis includes, it can be a action of the muscles,
Mhm.
it can be of the facet joints, we call it as,
Mhm.
or probably the nerve structure involved, that is the spinal cord or the nerve roots.
Okay.
So this broad spectrum of lumbar spondylosis,
अच्छा.
it includes one phenomena out of it called as back pain.
अच्छा. So back pain is just like a tiny, miny
Right.
part of.
So it can be because of the facet joint, बोल सकते हैं. It
अच्छा.
can be because of the muscles involved of the back,
Mhm.
or it can be because of the nerve involvement also.
Mhm.
So any of these three can cause a back pain.
Okay.
So that is called as lumbar spondylosis.
अच्छा.
और उसी का broad spectrum
Mhm.
is involvement of these three structures.
Acha. So, sir, as we spoke, I mean, just as you just mentioned, now you are seeing a lot of patients who are young, kids coming. Of course, sedentary lifestyle is one of the reasons. What are the other etiology or the reasons which we can say as a layman for this lumbar spondylosis?
Lumbar spondylosis is multifactorial.
Acha.
It doesn't have particular thing that yes, only I'm a hardworking fellow,
Hmm.
I'm only lifting weights, then I'll have back pain. No. Even you see our executives who are working in IT field or business executives who are traveling for prolonged air durations and all those things in flight. Cold temperature is one thing which causes muscle spasm.
Okay, so it aggravates.
It aggravates.
Acha.
The baseline is, yes, see, if you consider a building, it is made of columns as well as the walls.
True.
Columns are our bone, that is a spine,
Mhm.
and the walls include the muscles, and vitamin D is the main culprit,
Acha.
which is the cause for muscle weakness.
And I think almost a huge percentage of Indian population has vitamin D deficiency.
Exactly. So that is the reason that our muscles are weak.
Uh-huh.
The weight of the entire body, rather than getting distributed on the muscle and then coming on the spine, it gets vice versa.
Acha.
It comes then, if the muscles are weak, the weight will come indirectly more on the spine, and then it comes on the muscle. So that is why the disc, we call it as disc, is just like a shock absorber of a bike. So the disc gets degenerated, and then the vertebral bodies rub against each other because there is no shock absorber effect of the
because
disc.
that's worn out.
Yeah. And that gets worn out, that gets dehydrated, and so the effect is born on the spine per se. Then the nerves are involved. If the disc moves, it compresses the nerve. If the nerves are getting involved, then the patient gets what is called as sciatica.
Acha, which is like a sharp shooting pain which comes,
yes.
right?
So then the involvement of the nerve comes, and the patient gets sharp shooting pain in the leg, either one or two, depending on the disc where it's herniated, unilateral or bilateral.
I think sciatica can be another topic altogether we can discuss. Yeah,
Right.
sorry, please continue.
And in this, one more point I would like to add is, most important, see, when the patient comes to us, if he or she is compelled to sit down after a particular time, that is called as a claudication.
Acha.
Claudio is a Latin word which means I limp.
Acha.
Yeah. So it is called as a neurogenic claudication.
Acha.
The nerves are not getting blood supply. When we are standing or walking, the blood supply has to be regular.
Yes.
But if the blood supply is hampered, what happens? The nerves, they are starved of blood. They cramp. That cramping is called as claudication.
Acha.
Most common patient tells, I stand up for a few minutes, 1 or 2 minutes, I am compelled to sit down. My feet become very heavy.
Heavy.
Yeah, I cannot move. I drag my feet.
Mm-hmm.
So that is called as claudication.
Mm-hmm.
Or if I start walking, I am compelled to sit in 100 or 200 meters.
Acha.
So that is called as a claudication.
Acha.
Yeah, this is because of culprit called as ligamentum flavum.
Acha.
Yeah, which compresses the nerve,
Mm-hmm.
and the nerve is starved of the blood supply. This is because of we sitting always squatting down on the ground.
Okay.
Yeah, and lifting heavy weights. So
Mm-hmm.
it's a protective phenomena. Ligamentum flavum is
Mhm.
protective,
Mm-hmm.
but overprotection also is very dangerous.
True.
Yeah.
True.
So that is the thing, that over hypertrophy or
Mm-hmm.
over exaggeration of ligamentum flavum,
Mm-hmm.
it itself compresses the nerve,
Mm-hmm.
and then when the nerve is compressed,
Mhm.
yes, there is no blood supply.
Mm-hmm.
So this patient is compelled to walk a limited time and is compelled to sit after walking or standing for limited time. It's called as claudication.
Acha.
Yeah.
Okay.
So this adds to back pain.
Mm-hmm.
Yeah, muscles are weak. The joints, we call it as, what happens in the joints is facetal joints are there, which
Mhm.
connects one spine to another below, above and below.
Mm-hmm.
So these joints, because of working continuously, sitting posture or working in fields, bending down,
Mm-hmm.
these joints naturally hypertrophy.
Okay.
As a protective phenomena, but over hypertrophy of the joints,
Mm.
that again the joint hypertrophies and compresses the nerve.
Acha.
Hmm.
Yeah.
This is called as a facetal hypertrophy.
Yeah, because it grows big, so there is a direct
True.
compression on the nerve. Correct.
And then the nerve gets compressed.
Hmm.
So this is called as a compartmental phenomena.
Acha.
Getting
Okay.
it? The nerve is naturally protected by God
Mhm.
between the vertebral body in front,
Mm-hmm.
the ligament of flavum thin behind,
Mhm.
and the spinous processes which we feel from back.
Hmm.
So these bones are protecting our narrow and delicate spinal cord.
Acha.
So when either of this is hypertrophied,
Mm-hmm.
it compresses the canal.
Mm-hmm.
The nerve gets compressed, and then the back pain and the sciatica and the claudication, this spectrum starts.
So it's like a series of events which
True,
continues
true,
to happen.
true.
So, sir, if I ask you, pinpointing, that's what are the differences or difference in the symptoms or between a back pain and lumbar spondylosis?
Sometime or the other in life, we do have back pain.
Hmm.
But for every back pain, we don't visit a doctor.
Yeah, we don't.
See, if I get a back pain which is only for limited time,
Mm-hmm.
of mild to moderate intensity,
Okay.
without any red flag signs.
And what would be that red flag?
Yeah, so red flag would be if I am having continuous sciatica.
Acha.
Yeah, shooting pain in either of the limbs along with back pain.
Okay.
Second is if, yes, the power in the limb is reducing.
Mm-hmm.
If I have difficulty in moving my foot,
Mm-hmm.
these things are called as dorsiflexion and plantar flexion.
Okay.
This thing. If I have difficulty in holding my chappals while walking.
Acha.
Yeah, so there
The
is
grip
nerve
which is-
involvement. Yes.
Acha. Okay.
Or the fourth one comes that, yes, if I walk for a few steps and claudication, I am compelled to stop immediately.
Stop immediately.
Be it 100 or just 200 meters.
Okay.
So these are the red flag signs.
And we have to look out for these to understand that the back pain is worsening into
lumbar
lumbar
spondylosis.
Okay.
That time, yes, you should not wait and
Mhm.
you should consult your doctor immediately.
Okay. So, we have spoken about the differences between lumbar spondylosis and back pain. What are the risk factors, and what are the common symptoms and red flags? Now, if you have to understand about the diagnosis part of it, what is the role of CT, X-ray, and MRI?
Today, as the other thing goes, yes, we have also flourished in our medical field.
Uh-huh.
The investigations also, yes, today are very high tech.
Mm.
Exact lumbar spondylosis
Mm-hmm.
can be diagnosed by these entities, provided you do them correctly and for a true indication.
Acha.
X-rays depict something else.
Mm-hmm.
CT scan is useful for some other conditions,
Acha.
and MRI is useful for some other conditions.
Okay.
Each of them are corroborative and help each other.
So these all of them have some additive values
To
when it
each
comes
other.
to
Yeah.
the diagnosis part.
Yeah. For example, see, if a person is having only back pain
Mm-hmm.
without any other associated symptoms like sciatica
Yeah,
or
or the
claudication,
sharp shooting pain or claudication. Yeah.
then for this, you don't immediately go to MRI.
Hmm.
You just do an X-ray,
Mm-hmm.
see if the spine is okay. There is something called as pars interarticularis, like it is a small delicate piece of bone
Mm-hmm.
which connects the overlying vertebrae.
Mm-hmm.
We have 5 lumbar vertebrae. So each
Okay.
is maintained in a hierarchical order, one below the other.
Mm-hmm.
Yeah, they don't swindle around.
No.
Yeah, so there is a small delicate piece of bone
Yeah.
connecting these two spines.
Acha.
That's called as pars interarticularis.
Mm-hmm.
Now this pars interarticularis, because of multiple, you can say, comorbidities, or because of age, because of trauma, you have an accident unfortunately, or because of your even job factor, like especially the farmers who continues bend down and lift heavy weights. There is a small break or breach, small fracture in the pars articularis, and then the vertebrae, their stability disturbs. They slightly shift. When they shift, the muscles also shift of the back, and that causes continuous nagging pain.
Okay.
Yeah.
Okay.
This is especially common in the age group of say 40s or 50s or 60s.
Acha.
More in women because of obesity, overweight, and hormonal thing also. Yeah, they play a role because of osteoporosis.
Osteoporosis.
Yeah, early hysterectomies and all those things.
Yeah.
Even diabetes.
Yeah.
The second factor is patients who are taking oral anticoagulants,
Acha.
especially for the heart. Yeah, if a patient of post angioplasty or ischemic heart disease, hypertension patient taking blood thinners, so these blood thinners add to osteoporosis. Yeah, so in those they get a pars articularis fracture, which is seen on X-ray, dynamic X-ray we call it as, that is flexion view and extension view. We see how much the spine moves. Okay, on flexion and extension of the limbs, and we see that the defect is in the pars.
Achha.
That is a reason for chronic back pain.
Achha.
Chronic means a duration of more than 6 months.
Achha. So for over last 6 months, you are having that.
Because everyone might have pain for say 2 days, 4 days, or sometimes like recurring pain in 2 or 3 months. That is not called as chronic back pain. But if I am having continuous back pain, which is disturbing my lifestyle for more than 6 months and progressing in spite of taking oral medications. So that thing needs to be evaluated for a small pars fracture, which is seen in an X-ray and a CT scan.
Achha.
Okay. Now coming to MRI.
Yeah.
MRI is indicated when if you have sciatica, if there is a sharp shooting pain at the limbs, a limb movement is reduced, or the muscles are getting atrophied, there is weakness. Now this comes rarely, but in case of spinal tumors, which mimic as lumbar spondylosis.
Okay.
Yeah.
Okay.
So around 1 to 2% of the cases of lumbar spondylosis, they have spinal tumors.
Oh, 1 to 2%.
Yeah. Either the tumor is attached to the nerve, it is intrinsic inside from the nerve, or it is outside the nerve, that is from the dura or the bone, and that is pressing the nerve. So it can be either of the three scenario, and that mimics as spondylosis.
Achha.
So in these cases, we have early MRI.
Okay.
Yeah. If the patient is also having disturbed urinary or bowel complaints.
Achha.
Yeah, this is an important point, because the same nerve which goes to the lower limbs, even those have supplies for the urinary control, bladder control.
Achha.
Yeah, that's called as a sympathetic and parasympathetic bladder control.
Okay, so that can also be a very big red flag.
Yes.
When it comes to lumbar spondylosis.
In case of spine patients, they do have symptoms like incomplete micturition, or frequency is increased, or by the time they go to the bathroom, they urinate. Yeah. So sphincter weakness. So these things are a red flag for even spine. Yeah. So with that time indicate of early MRI.
Achha.
So these are the things.
Okay. So now moving on to the next, part of it, which is the treatment aspect of it. So we have conservative treatment and then we have surgical options, right?
Yeah.
So when it comes to when it comes to the conservative approach of it, what's the role of, we'll start from something very, basic, which is posture correction.
Right.
What is the role of posture correction, core strengthening, and physiotherapy? And I mean, if done at an early stage, can we really avoid a surgery, or surgery is usually mandatory in such cases?
See, as the thing goes, prevention is better than cure.
True.
Yeah. So I should first take care of my back pain.
Correct.
Which should be cured in time. And then the further degradation or further deterioration is avoided. So most important is, yes, lifestyle first. Second is your comorbidities. If you're having diabetes, you're having high blood pressure or hypothyroidism, or any other anti-cancer drugs or anything like that. And then comes exercises.
Achha.
Yeah. See, if I'm having back pain, I go on exercising. That is going to add up to my pain, not relieve it.
Achha.
Yeah. Crux is you have to do exercise, but not at the cost of having pain.
Okay.
So what in toto we do? Evaluate the patient. Yeah. See how much is the back pain. See what is the cause for the back pain. Yeah. If I'm having muscle spasm, that is the most common. Almost everyone has a muscle spasm.
Yeah.
And vitamin D you check.
Yes.
Vitamin D is okay. You go ahead. First relieve the pain, relieve the spasm by antispastic drugs, antispasmodic drugs. Yeah, muscle relaxants. That is for a time being. Say you give for 5 to 7 days. In that time, ask the patient to walk is the only exercises. Yeah, don't do other back exercise because you're relieving the spasm on one hand by medications and exercises you're increasing the spasm. So, yeah, so start with the medications for 5 to 7 days. Rest, if you ask, in back pain is only for 2 days, max to max 3 days. Prolonged bed rest is not advocated
Advisable
today.
at
Yes,
all. Okay.
because it has its own complications like DVT, vein clots. Yeah, and better is for 2 or 3 days only back pain के लिए bed rest. Then you do graduate exercises. What is meant by graduated exercises? I don't start immediately with all the yogasanas and yogas and all the other back exercises. First, I start with brisk walking.
Acha.
Yeah, brisk walking helps to relieve the muscle spasm.
Acha. Okay.
Yeah, it need not be for 4 to 5 kilometers. I start initially with 200 or 300 meters. Gradually, as I am accustomed to it, I start increasing my duration of walking.
Acha.
Yeah.
Okay.
It need not be the other thing. Yes, 10,000 steps per day, 10,000 per.
So much trending.
No, not at all. Because your routine is different.
Yeah.
My routine is different.
Yes.
Your body structure is different. Mine is different. There's so many social or ethnic differences. So it need not be that catch up 10,000 only. I might be accustomed or my body is fit for 8,000. You might be fit for 15,000.
So listen to your body.
Yeah. So don't go behind that. Count that, yes, 10,000 has to be done.
उसने किया तो मैं भी करूँगा.
Yes. See for your fitness, see for your routine, see for your time schedule, and then accordingly you plan. Yes, but brisk walking is a need for time. We have to walk at least for 4 to 5 minutes today each day.
Achha.
If you do brisk walking, that's just short of running. Yeah, we should have fullness of breath and sweating for even of say half a kilometer or 1 kilometer. That is enough for keeping our cardio as well as the muscles fit.
Of the back.
Yeah.
Fit. Correct. So when we talk about regenerative therapies like PRP and stem cells, do they actually, contribute, and what kind of role do they play when it comes to lumbar spondylosis?
Spondylosis actually has no role for these things.
Acha.
Yes, stem cells and PRP therapy are coming now. It's still in very, very primitive stage.
Acha.
We don't know about the autogenes. We don't know about their antigens. We don't know whether it is autologous or homologous or heterologous.
Acha.
Plus, many ethnic factors also adapt to it.
Okay.
So, better avoid those. Spondylosis today, no. These PRPs and stem cells don't at all help. We go for back exercises after our pain is relieved. Back strengthening exercises. Yogasan, yes, definitely. Back exercise is only a part of yogasan. There are different yogas.
True.
And back exercise form one part of the yogas. So if we strengthen our back muscles, they are going to definitely help. They are going to form a strong column to protect our spine.
Acha.
Yeah.
Correct. Eventually. Yes.
So these back exercises will help us in preventing the future back problems in the geriatric ages.
Acha. Okay.
Getting my point?
So it's on the long run we are looking at.
Yes.
Yeah.
So focus things like they go in a long way. If I am doing exercise regularly, it should be regular. It should not be over exaggerated exercises. I go on lifting 10 kg today, so 20 kg, 15 kgs.
No, don't do that.
I should be able to sustain my health and my lifestyle in a long run.
Okay.
Yeah. So daily exercises, daily back strengthening exercises, changing of position very frequently.
Acha.
Coming to the executives, if you have
about the working chairs and all such stuff.
Sitting, see, when I sit, the entire weight of the body is concentrated on my lower back.
Yes.
Yeah.
Yes.
So I should sit not more than 40 minutes or 45 minutes in one position.
Okay. So after 40 minutes, get up, take a round.
Yeah. Just get up, take one round in your room and again sit back.
Acha. That
helps a lot. Yes, it helps a lot. Chairs, yes, we do have chairs comfortable. We do have chairs for maintaining the lumbar lordosis, we call it as. That is the curvature of the lower spine.
Yeah.
Though really help. And even patients who are having, like you can say, coccydynia or pain in the tailbone, you can definitely use good cushions.
Yeah. Those are called donut cushions.
Yeah, donut cushions.
Yeah.
Okay, so these things do help. But main crux goes again, yes, don't sit in one position for prolonged, like 2 or 3 hours.
Okay.
Yeah, the duration has to be, say, maximum 40-45 minutes. Just get up walk few steps and sit back.
Sit back. So, sir, we spoke about the entire range of conservative treatments right now. So, when does one becomes eligible or has to go for a surgery in such cases?
Indication for surgery are, yes, the red flag signs I called it as.
Mm-hmm.
If there is a lumbar intra-articularis fracture,
Mm-hmm.
it is going to eventually increase the workload on the spine.
Mm-hmm.
The spine becomes more degenerated.
Mm-hmm.
Yeah.
Mm-hmm.
And it has an effect on the above and the below spine also.
Achha.
Yeah, if L4-5, we call it as lumbar fourth and fifth vertebrae.
Mm-hmm.
If there is a pars fracture, because it most commonly occurs at L4-5 only,
Mm-hmm.
because that is a joint
Mm-hmm.
which is most involved in a flexion, in extension,
Achha.
or what is called as a lateral bending.
Lateral bending, yeah.
Yeah. So there the pars fracture is most common. But if I don't repair that in time,
Mm-hmm.
it will have an effect on the L3 vertebrae
Yeah.
and even the down sacral vertebrae.
Yeah, because your entire gait also
Yeah, it
takes a
changes.
toll. Yeah.
And then we have what is called the scoliosis, the bending of the
The
spine.
bending of the spine.
Yeah.
Okay. So it's like one-to-one, one-on-one, one-on-one.
Yeah. The second thing comes that you have a disc herniated in the MRI.
Okay.
The disc is pressing on the nerve
Mhm.
significantly.
Mm-hmm.
Yeah. The annulus, disc is just like a capsule.
Mm-hmm.
When the capsule ruptures, the inside material, the gel, it pops out.
Pops out. Yeah.
That's called as, in medical term, we call it nucleus pulposus. That
Achha.
gel is nucleus pulposus.
Yeah.
So that protrudes and that presses the behind nerve.
Achha.
Yeah. So when that pops out, you cannot just put it back by any means.
Mm-hmm.
Yeah. So that has herniated, disc is herniated, and it is significantly pressing on the nerve.
Mm-hmm.
You're having the sciatica pain continuously, in spite of taking medications, physiotherapy sessions,
Mm-hmm.
and you are having weakness in the lower limb,
Achha.
neurological involvement. That is the indication for early surgery.
For inner surgery.
Yes.
Okay, great. So we'll quickly move on to the next segment of the podcast, where I have sorted some questions for you. So these are a combination of some myth and facts, some quick answers for you.
Yeah.
So I'll just read out those for you, and let's get started with that. So my first question to you is: rest or exercise if you have lumbar spondylosis?
Rest followed by graduated exercises is the best thing.
Okay.
Yeah, we do
So-
rest for 1 or 2 days.
Huh.
We take medications or no, plus or minus,
Mm-hmm.
and then we start gradual exercises.
Achha.
That is the best thing for back pain.
Okay. What are the top 3 questions every patient with lumbar spondylosis should ask their doctor?
When is my back pain going? Will it go with medications and lifestyle changes, or do I need surgery?
So basic approach, whether conservative or
Yeah, it is.
Maybe
You can say individual. We can customize the case individually. We
but
see
these 3 can be
these three form a base.
the bigger
Yeah.
umbrella. Okay. If you have lumbar spondylosis, you should avoid all exercises. I think I already know the answer, but still.
No, don't avoid all the exercises.
Okay. Sitting straight for long hours is good for your spine.
No,
Myth or
not
fact?
at all. It's a myth. No.
Okay.
Yeah. Avoid sitting for long hours.
Mhm.
Take few steps after every, I said, like 40 to 45
Mm-hmm.
minutes, and do keep changing your position.
Sure. One posture mistake most people make daily.
Most people, they sit on the ground,
Acha.
and for hours they are involved in either reading papers
Acha, sitting on the ground.
or studying.
Okay.
That is the worst thing.
Okay. Your go-to advice for someone newly diagnosed with lumbar spondylosis.
Do take adequate rest.
Mm-hmm.
Do go for graduate physiotherapy,
Mm-hmm.
and do exercise yourself regularly.
Mm-hmm.
And if you have red flag signs, as I
Mm.
mentioned, do consult your doctor on time.
On time. Okay. Does sleeping on the floor helps?
Sleeping on the floor is really good, but getting up and down from that ground is not at all good.
Acha.
If you have arthritis in the spine, definitely you have some weakness or arthritis of the knee joint also, of the hip joint also. Yeah. So when you try to get up from the ground, unless and until you move your spine and knees, you won't be able to get up.
Acha.
That is worse.
Correct.
Yeah. On the contrary, I would suggest you, if you're not adapted to taking a mattress, you sleep at a height,
Acha.
be it just a couch or be it a thin layer of mattress. Okay. And you can turn to a side. Okay. Turn to a side, keep your legs down, put a weight on the shoulder and get up.
And
This is the
get up.
best thing,
Okay.
because the weight comes on the shoulders
Okay.
and not at all on the cervical or lumbar spine.
So turn towards one side, put your
And
legs down on the from
ground.
the bed,
Yeah.
and then
get
lift
up.
your body up.
Exactly.
Don't get up like this.
This helps in a lot of even cervical spondylosis, giddiness patients. Huh?
Yeah, it does, because I myself, I kind of have these blackouts at times. I think let's not get there.
We
But
are
then-
in a jerk. We are always in a
yeah.
jerk.
But
We
then
try
there are
to
many
get up
times when
straight.
I get up like that, I feel a lot better.
Yeah.
Okay, moving on. How long is too long to sit when you have a spine issue? You said 40 minutes.
Yeah, that 30 to 40 minutes is a pretty adequate time.
Mhm.
And you change your position, even for the spine operated patients,
Acha.
which we operate.
Mhm.
Yeah, be it for just for disc or for fixation.
Mhm.
We always advise, yes, you sit, but not for
But not
more than 40-45 minutes.
ठीक है. Ice or heat? What works better for back pain relief?
Both are good. For immediate relief, you can say heat, but
Mhm.
for prolonged relief, ice is better. Ice packs are better.
Is standing all day better than sitting for spine health?
No standing for a long time also, and no sitting for a long time also. Yeah.
Okay. What's the most common mistake patients make after getting diagnosed?
Patients just keep on lingering around. They
Mhm.
don't take medical aid, be it
Mhm.
in the form of physiotherapy or medications,
Mhm.
or even diagnosing from right person
Okay.
on time.
Okay.
Yeah, when it gets
So-
aggravated, they cannot walk.
Mhm.
When are compelled to take rest for so many days, take leave from job
Mhm.
for so many days, then is a time when you come. But as you say, a stitch in time saves nine.
Mhm.
So by the time, if you're delaying, the medical treatment goes away and the surgical comes in.
Comes in.
So even we don't want that you come at that late stage. That is the thing.
True.
Yeah.
So that's about lumbar spondylosis. We
Yeah.
all heard it. We heard everything about it from you. Before I let you go, I want to hear some cases from you, which you have, treated for the cases of lumbar spondylosis, and about the outcomes which were really satisfying.
See, the basic thing is, as the person grows old,
Uh-huh.
he or she should be keeping walking.
Okay.
If your walking is hampered,
Mhm.
it is not good for your overall health and well-being.
Mhm.
You will have dietary problems,
Mhm.
digestion problems,
Mhm.
BP sugar will shoot up.
Okay.
So main crux comes, whatever we do treatment for spine,
Mhm.
it should help you in keep walking,
Acha.
because that is the thing.
Okay.
Yeah, to tell you, I have operated on my own uncle
Own
last
uncle.
week. Yeah.
Okay. That's nice.
He is a 74-year-old man,
Okay.
high diabetic, hypertensive,
Okay.
quite obese. He's
Acha.
110 kgs.
Oh my god. Okay.
Yeah, so he landed up into having high BP, and because of it was just because of he was avoiding walking.
Acha.
He had pain in back
Okay.
with a severe sciatica,
Mm-hmm.
and so he avoided walking.
Acha.
When he came to me,
Mm-hmm.
I saw him. I said, "Yes,
Mm-hmm.
uncle, you needs to be evaluated for spine."
Mhm.
We did an MRI.
Mm-hmm.
We did an X-ray for him. He was having, as I called, spondylolisthesis. His
Mhm.
spine was shifted
Mm-hmm.
because of degeneration and obesity,
Mm-hmm.
and his nerve was compressed.
Acha.
So he was dragging his left foot.
Dragging.
Yes,
Okay.
and plus because of this, he had an issue of the heart also.
Acha.
So I equally showed him to a cardiologist. He said
Mhm.
he needs to be stented
Acha.
for the angioplasty. This thing.
Okay.
I said, wait, either of the two? He said,
Uh-huh.
no. First you operate spine.
Uh-huh.
Yeah, because if I operate him for heart,
Mm-hmm.
I'll be putting you on blood thinners.
Mm-hmm.
Then you won't be able to operate for
It will be
spine.
difficult for you
For
to,
the spine.
because we need to stop
Yes. So I operated for spine.
those. Okay.
He ambulated on next day,
Uh-huh.
and after a week, I
Uh-huh.
again operated him, asked the cardiologist to operate him for
The
stenting.
stent placement.
And
So
today,
do you feel a little anxious when you treat on some your own family member? How is the feeling?
the thing goes, yes, we do feel anxious,
Yeah.
but once in OT, it's
Then
OT.
you are a surgeon.
Yes, and we are surgeon.
And he is the patient.
Yes. So that thing. So treat patients very well, but see if the patient is fit or not. My
Fitness.
say home
check.
message for you would be, we see if the patient is medically fit,
Mm-hmm.
be it a geriatric or a pediatric patient. I've operated a patient of 94 years also,
Mm-hmm.
but definitely the patient should be fit from
Mhm.
anesthesia and
Mhm.
surgical point of view.
Okay.
Yeah.
Okay.
So motive is to give him a healthy life,
Uh-huh.
and he should keep on walking.
Okay. On that note, thanking you once again for coming on this podcast. Wishing you all the best for many more patients whom you are going to treat, and for all your future endeavors. Thank you, sir. It was lovely having you on this discussion today on lumbar spondylosis, and I'm pretty sure we have covered so many topics today.
Thank you, Tushita. Thank you so much for a nice discussion.
Thank you, sir.
Yeah.
On that note, signing off, Dr. Tushita, Sahyadri Health Talks. Thank you.